and welcome to the Cass Health Podcast, the show where we hope to connect our community with healthcare information that's relatable, understandable, and useful to your life, and where you get to know better the neighbors providing your care here. I'm your host, Ann McCurdy, and today I'm joined by the Senior Life Solutions team. And in today's episode, we're talking about mental health. Before we get started, two quick disclaimers. First, the comments in this podcast do not necessarily reflect the views of Cass Health. Second, the information in this podcast is not intended to be construed as personal medical advice. Always consult your primary care provider with your questions and concerns regarding your health. Welcome to the Cass Health Podcast. Karmen and Kacey, thank you so much for taking time to be here today. We're excited to talk with you both.
Thanks for having us.
Thank you.
So I'll have you go ahead and both introduce yourself real quick. So Karmen, you're up first.
Hi, I'm Karmen Roland. I'm the Director for Senior Life Solutions here at Cass Health.
And I'm Kacey Peterson, and I'm the Program Therapist for Senior Life Solutions.
We appreciate your time today, and we are going to start off with some fun questions to get to know you. So Karmen, where are you from?
I'm from right here in Atlantic, born and raised.
Born and raised. And Kacey?
I'm actually from Kacey.
Kacey from Kacey. Easy
Yes.
to remember. Okay, how about favorite TV series?
Oh, Big Bang Theory, of course.
Oh, okay.
Love it.
Yeah.
Antique Roadshow and pretty much anything paranormal.
Ooh.
I like doing that.
My son Johnny would argue that Antiques Roadshow has the catchiest intro song of any TV show.
Ooh.
So, and if you're cooking dinner to impress, what are you making?
Well, I just recently did a new recipe and was so proud of myself. I actually did a picture on Facebook for it, but it was a grilled stuffed bacon-wrapped pork loin on the grill.
That does sound pretty fantastic.
Yeah, it was pretty fancy.
And how about you, Kacey?
I would say anything Mexican, but enchiladas is something that I do really well. So
We're going to give you $50 to spend locally. Where are you going, and what would you get?
I'm going to go to one of the grocery stores and get food. I have bottomless pit grandkids and a couple of kids still staying with me, and they are just eating all the time.
You got to stock up.
I do.
I would definitely go to like a thrift store, or I'm a big antiquer. So anything that I could repurpose and use like outside as decor would definitely be what I would navigate toward.
Fun. That sounds really fun. How about favorite holidays?
Christmas. Absolutely.
Both of you real quick on that.
Yeah. My second's Halloween, but
Mine too.
Okay, well, now I'm curious. And your third favorite holiday. Is it still a match?
I'd say probably Thanksgiving.
Oh, okay. What will we never catch you doing?
anything involving heights.
Singing in a cover band. I'm not a great
Oh,
singer.
no, I'll do that.
So, yeah.
Wait, so you'd only sing original material
or
then,
like karaoke, you
Or
know,
karaoke.
I can do that.
Yeah.
But never professionally.
And what's better, the book or the movie?
Well, I always hear the books are better, but I like to watch the movie.
I would say book, but I don't take enough time to read. So most often I'm navigating toward the movie, but book is usually better.
And if you're driving alone in the car, what are you jamming out to?
Absolutely nothing.
Oh, really?
I love the silence.
Gives you just like a little like downtime to just like
It does.
decompress and nobody needs you.
Yeah.
Yeah.
I don't have anyone saying, hey.
That's all right. And Kacey, as you're driving over here on the commute,
Yeah. I would say I find myself driving in silence more often, but if I'm really rocking out, I'm kind of old school and I'm very eclectic. So I would say Leonard Skinner, Creedence Clearwater, and then I also, on the flip side of things, grew up with kind of that hard country, so Johnny Cash and Hank Williams Jr., that kind of stuff. So
that is a contrast, but it's fun. I
Yeah.
like it. Pets at home?
Yes, I have two very energetic Boston Terriers, and they're still puppies.
And what are their names?
Buckner and Luna.
Buckner and Luna. Aw. And how about you, Kacey? Pets at home?
We did have a dog that passed away just about a year ago, and we've been looking for another dog ever since. We are Rottweiler people, so we've always had a Rottweiler. This is the longest we've gone without a dog, but
So sometime soon again in your
hopefully.
home. Hopefully in your home.
Hopefully.
How about next or dream travel destination?
Well, I would love to go to Alaska. Eventually I'll make it there. I would love to absolutely dream to go to Ireland. I am going this fall to Hawaii, though.
Oh, well, that doesn't sound bad.
No. Going to visit family.
I would say Netherlands. I really want to go to Rome, and just Italy would be Greece. Those areas would be very, very fun.
It all sounds pretty fantastic right now. During this next section of the podcast, we like to talk to our guests about why they chose the career that they did. So, what was it that drew you in? What was the education and training behind it? And, you work very closely together, but you do have very different roles within the Senior Life Solutions program. So, Karmen, I'll start with you. Initially, nursing. Why nursing, and what's the path that you've taken to get where you are now?
Well, quite a few years ago, I actually worked for a home health agency as a file clerk. And in auditing charts and things, I really got kind of sucked into that whole medical field thing. And it just really amazed me, the help that people were doing for others in their community. And it really kind of turned me towards looking into a nursing career. And when I finally did get the opportunity, I did go to Iowa Western Community College and got my nursing degree. Since then, I have worked primarily in long-term care. I knew right from when I was in nursing school doing clinicals that geriatrics is really where I wanted to be. I noticed, that I got to see the good, the bad, and the ugly of all the elderly geriatric care that is out there as far as their health and their emotions and their feelings. And it was so sad to see people be so emotionally distraught and few resources there for them. And so then the opportunity to become the program director for this program came into play at a very good time. And I took what I already knew about geriatrics and I applied it into this. And now I get to do the thing that I love the most, and that is to emotionally help those that I feel need it probably the most, is our vulnerable geriatric population.
Wow, what a perfect fit, honestly. And Kacey, how about you? Tell us a little bit about your career and how you got here to Cass Health.
As a young girl, my parents were going through a divorce, and like many parents, my mom was kind of looking to get me some help to kind of help process through all of that. And it was a struggle. She was a single mom and trying to get back and forth to appointments and trying to find somebody who was the right fit for me at the age that I was at was really difficult. And so we went through several different providers before I finally found somebody that I connected with. And when I connected, I just remember that feeling of being understood and feeling like somebody was finally hearing me and that somebody was helping. And I just, even as young as I was, remember thinking it shouldn't have been that hard. It shouldn't be that hard to find somebody that could help. And so from that point forward, it was, kind of set for me. And I knew I wanted to be a therapist, knew I wanted to work with children. And so that's what I did. And how I ended up here is, I kind of worked in many different roles. I was in private practice, and I was also clinical director for a time of a mental health and substance abuse organization, and worked in an executive director role and served on some boards. Became an advocate for vulnerable populations. Knew that I wanted to center my services in a rural area because I came from a rural area and I recognized the need, especially for children. And so as I kind of centered around that, I got a call from somebody with Senior Life Solutions, and they were looking for a therapist over here, and it was completely out of my wheelhouse. I had never worked with anybody over the age of 21 before, thought, what the heck, we'll roll the dice. I was a play therapist and did a lot of interactive stuff. When I was in private practice, I was located in a school setting, so it was a very different situation for me. But I found very quickly that, one, the team and just the hospital environment was very welcoming, and two, that geriatrics was, as Karmen said, another very vulnerable population that often gets overlooked. And knowing that, because I'd done a lot of advocacy work, I felt like there was maybe some overlap, and I was pleasantly surprised at just how much overlap when we think about kids and all the transitions they're going through. I think that happens again when we get older. We start going through a lot of life transitions, and just having the opportunity to work with that population has been more rewarding than I ever would have guessed. It's even more so than I think working with kids, because there's the opportunity to see it all come about, and there's a level of accountability there that with kids, you're working with the family, you're working with the teachers, you're working with a lot of different factors, and it's just you and the patient here, and so it's just been it's been a really awesome journey.
So Senior Life Solutions is a behavioral health program. So you do work with geriatric patients on mental health, and you're very passionate about helping our communities celebrate and recognize Mental Health Awareness Month, which is May. We wanted to have you guys here to talk about mental health, and boy, I feel like this could be like a 10 podcast series at least, right? We'll cover all the highlights today. So right off the bat, we talk a lot about breaking the stigma about mental illness and seeking help. And I think part of the way we do that is talking about how common and widespread mental health issues are. So Karmen, could you share with us some information about mental health in today's society?
Sure. I know that a lot of people don't understand how prevalent mental health is, because, they think of mental health as just your bipolars, schizophrenics, OCD patients. That's just a part of mental health. A lot of the things that people tend to forget of mental health is depression, anxiety, loneliness, things like that, the things that we experience on a daily basis. Everybody has mental health, whether you believe it or not. Happiness is your mental health. So everyone experiences it every single day. The one thing is that we have people that struggle with their mental health and the negative aspects of that. So basically, we're seeing that about 21% of all Americans are actually affected by the mental health conditions. And it's more prevalent actually in women than it is in men, where women is about 25.8% and men's about 15.8%. So if you think about it, it's a little over 1 in 5 people in the United States that suffers from some type of emotional well-being crisis.
And I think to add to that, just with specific populations, especially, children, a lot of people don't really think about, the struggles that kids go through as being mental health related, but they certainly are. Children have physical health needs and they have mental health needs just like adults do. And I think just to kind of throw out some common statistics, ADHD, anxiety, behavior problems, depression are some of the more common disorders that we see among kids. But estimates for, having those range from, anywhere 4.4% with depression to upwards of, 10% with ADHD. So it's also incredibly common among children. And throughout this pandemic, we've seen mental health needs skyrocket across the board, not just for kids, but in other populations as well. And so especially anxiety disorders, we're seeing a lot of anxiety disorders in our kids coming through now. Healthcare workers, 40% of respondents between April and May in 2020, right at the start of the pandemic, were reporting some symptoms of PTSD, anxiety, or depression, and that number has just gone up. And so, they've talked, you'll hear a lot in the news about kind of the second pandemic being mental health issues among healthcare workers, and it really is. And I think that's a whole nother population that struggles with the stigma and that struggles with seeking help, especially in our smaller towns. And so in a recent study, just of nurses alone, over 12,000 nurses this past January were surveyed, and 2/3 reported symptoms of anxiety. 43% reported feeling depressed, and I think those are significant numbers. And then elderly, as we've talked about, 20% and higher of individuals 55 and over are struggling with, some sort of mental health concern. So I think, it's not, it doesn't affect, it doesn't bias, or it's not biased in terms of your socioeconomic status or your gender or, whether you live in the city or a small town. Mental health is mental health. And I think that when we look at those statistics, it definitely leads to the need for more conversations.
How can I tell the difference between depression and feeling really sad, or grief and loss? How do I navigate those? What's the differentiation there for someone?
So sadness and depression are obviously closely tied, but they are not the same. Sadness impacts your mood. Depression impacts your life. And I think, sadness is a primary emotion. It's a universal emotion that no matter where you come from, we recognize the signs of sadness. It's part of what makes us human, and that means that it's felt, daily to different degrees. And everyone gets it. Being sad is just a reaction, usually to a specific trigger, to an event that's happened. But it's completely normal. It's healthy. It's purposeful. It's necessary. And in most cases, it passes. It's not going to hang around. We might have a low mood, but that wave of sadness typically doesn't last very long. Depression, on the other hand, is a mental illness, and it involves a lot of different symptoms, sadness being one of those symptoms. And depression, typically, we start to see a negative impact on your life. We start to see it lasts longer than 2 weeks, is one of the criteria, and it usually is accompanied by several different warning signs. It affects the quality of your life. And, when we talk about grief and loss, that's a difficult one because I don't think there's any timetable for how long it takes us when we lose somebody to get through that. And I think people put a lot of pressure on themselves. They tell themselves, I should be over this by now, or I should be further along in the grieving process than I am. They look at other people and compare themselves. And I think giving yourself that time, having compassion for yourself and allowing yourself to kind of navigate that journey is important. However, there are things that you can kind of key into that can tell you when what we call, compound grief or complex grief, when it's lasting a little longer than maybe it should. And typically what we're looking at for grief is that it's, after a month, 2 months, 3 months, if you're not feeling, it doesn't necessarily get better, but it should get a little less overwhelming. It shouldn't be, you're not quite as prone to tearfulness perhaps, or you're not thinking about it quite as often. You're able to sort of balance, you're able to see a picture without immediately bursting into tears. So it gets a little softer, I guess, and a little less overwhelming over time. But, grief, again, typically is going to decrease over time, and it comes in waves. So a lot of people that are going through the grieving process can attest to that, that when it comes in waves, those waves can be huge, and they can knock us down, and they can last a while. But they also pass, and then, we feel a little bit better, and we feel like we've kind of released some of that, and it comes again. But the time between the waves should get a little longer each time. And the waves, as difficult as they are, we should bounce back from those, as time goes on. We should still be finding joy in life. It's okay to laugh and grieve at the same time. And we shouldn't be isolating. We should be withdrawing. We shouldn't, find that, nothing in our life is bringing us happiness or joy. And so those are usually signs that we look for, is that, is it getting harder, not easier? Are you finding that it's not just isolated grief around that loss, but you're losing interest and you're losing pleasure throughout your life, and the quality of your life is steadily decreasing as a result of that loss? Are you ruminating? Are you thinking about it constantly? Is it getting in the way of your functioning? Are you avoiding certain things that in the past you have not avoided? Those are the red flags that we would look for to to say maybe we need some additional help to kind of process through this.
Are there certain risk factors that can increase our chances of mental illness or having a difficult time with mental illness?
Absolutely. Research is learning more and more as time goes on about the biological component to depression and anxiety. But we know that if you have had parents or immediate members of your family, there's a genetic component there. And so, if your parents or if one of your parents struggled with anxiety, the risk of you also struggling with anxiety goes up. Is that because it's, part of your genetics, or is it because, healthy coping with anxiety was something that wasn't necessarily modeled for you at home when you were younger? I don't know that you can completely separate those things out. And so we know that environment does play a role. Past trauma plays a role. There's the ACEs questionnaire is a big one today.
And ACEs, is that the childhood events of, help me out there.
The adverse childhood
events.
Yeah.
There we go.
And so, if you, prior to the age of 18, experience certain adverse events in your life, you are more at risk for developing depression or depressive symptomology later in life. And so it's not always, nothing is a guarantee. There are certain factors that make some people more resilient than others. And so I don't know that we can isolate all those things, but we know genetics, biology, environment, and also, whether or not you've been able to kind of overcome certain situational events or traumas in the past is also a sign of resiliency, and whether or not you'll be able to overcome future events. And so, there's a lot of factors that go into that. Emotional supports, how many supports do you have in your life? Are you somebody that practices gratitude? Are you somebody that practices, mindfulness and self-care? All of those risk factors can go out the window if you're somebody that practices regular self-care and, you seek out help, you recognize the warning signs in yourself, and you take time to kind of de-escalate and distress and all those things.
It's kind of like, this comes to mind, and again, maybe it's part of that breaking the stigma, but, I know I'm at risk for diabetes. Mm-hmm. And so I do those preventive care things to keep myself from developing diabetes.
Right.
So it's the same thing that if we recognize, I have some risk factors here for some mental illness. I have to be mindful of what I do and what I allow into my life and the things I say and do and participate in to keep myself healthy.
And absolutely. And, and going back to, the things that just the risk factors in general, physical health, if you are exercising regularly, we know that, from the chemicals that are kind of released in your brain, when you're, serotonin, the things that kind of the feel-good chemicals in our brain that get released when, we're productive or when we're exercising, when we're accomplishing tasks even. To-do lists is another thing that kind of boosts your mental health, because every time you cross something off, you get a little boost of feel-good chemicals.
Is that for real? Because, I for everybody who's listening, sorry, I have my notebook right here. And I swear to you, it does. It feels so good. Even sometimes, I'm so guilty, I will write stuff down that I already
just
did.
To cross it off, right? Yes, I know. And it gives us a sense of accomplishment. And so, that reward system in our brain, the same reward system that gets triggered for substance abuse, can be used to our advantage when it comes to kind of monitoring our mental health. But I think, you're right. Taking those precautions, recognizing when we are more at risk for mental health, issues or struggles is incredibly important. And there's a really cool slogan that before Stage 4, and I think it's Mental Health America that coined that slogan. And it's really trying to push and to get people to emphasize mental health in the same way that they emphasize their physical health. When something is off, when you feel, kind of in a funk, or you just feel like something is wrong, people are much more likely to go to their doctor and say something, but not with their mental health. They either ignore it, or they assume that that it'll pass, that they can get over it, or they can get through it.
I always like to try to tell people that, your brain is also another organ of your body.
Exactly.
And we're not afraid to go to a cardiologist if we're having issues with our heart, or an oncologist if we have cancer. our brain is just another organ, and mental health is a part of the problems that we can have with it. And therapy is the treatment, and self-care is the treatment.
Right. And recognizing that, patients that have cancer, patients that have diabetes are more likely to suffer from mental health because that's stressful. I mean, that is stressful,
And then in the same aspect with that is those who have mental health are at higher risk for cardiac issues and for diabetes and for immune problems and strokes and heart attacks.
It's all very interconnected.
Right.
Very much so.
Because, again, the brain is an organ. It's part of the body. Again, all these things work together. So, Karmen, this leads us right into that conversation of all these physical symptoms.
Oh, absolutely. There's so many physical symptoms, and what happens is a lot of times people will experience these symptoms that are connected to their emotions, like depression, anxiety, but they go to their medical doctor and they rule out that physical aspect because that's what the doctors are taught to do, is look at the body and what's going on physiologically, what's going on inside their body and how can they fix that. And sometimes it gets overlooked that this can be, their emotions triggering these issues. And so a lot of times they may not receive the care that they need because of that. It is getting better, but we just need to keep re-educating our providers and letting them know to everybody, you got to look at that mental health as well because, we're a whole person. So you have to look at us holistically. A lot of the things that people may go to the doctor for, like they're having aches and pains and they have no idea why. They're tired all the time. Maybe their sex drive's down. They don't want to eat anymore. They sleep too much. They don't sleep at all. They start having problems with substance abuse. They have weakness. They might be feeling short of breath or having chest pains. That's a really common one with anxiety. People end up in the ER or at their doctor's office complaining of chest pains and they can't breathe and they think they're having a heart attack and truly what they're having is a panic attack, which is a very strong feeling of anxiety. These are just a very few numbers of those things that you can experience and a lot of people will go to their medical doctor for. Once they've ruled everything out, then a lot of times they'll say, okay, let's look at the mental health aspect of it. And then that's when they find out if they do choose to go into treatment and they start working on their mental health and then all these other things kind of fall into place and start resolving themselves or lessening, then they know it was more triggered towards their mental health rather than an actual physical problem.
And I think the medical field in general, I think we're starting to see the mental health and the physical health side of things merge more. I think it's an ongoing conversation. It's one where on both sides, more education and more dialogue needs to take place. But we're seeing providers, healthcare providers, primary care providers screening for mental health issues more during their annual assessment, which is incredibly important because, they are the safe person. They are the go-to person. And a lot of times, especially in older populations or in areas where there's not a lot of awareness around mental health, I think that's where that conversation is going to start, is in your doctor's office. And so it's been great to see that merge start to happen. I think there's a lot more work that needs to be done there on both sides to navigate that. But I think we are starting to see that. And also as more and more organizations, states, hospitals start looking at more proactive care versus reactive. So less, inpatient and kind of dealing with things after they've happened and more proactive education. Let's get there before we get to the place where there's a need for inpatient care.
And part of it, you're right, on the provider side of thing is like training their brains, to look at the whole picture again. And then as patients to advocate for ourselves too and say, boy, we're not finding an answer there. And to have an awareness to say, oh gosh, maybe there's something else going on.
And I think also clarifying for patients that when we're saying this is a mental health issue, we're not saying this is in your head. We're not saying that you're imagining that these symptoms are happening. These symptoms are happening. These physical things in your body are manifesting, but they're manifesting as a result of mental health related issues. And so I always explain it as, you might have an actual physical issue going on. Maybe you have a pinched nerve somewhere up in your shoulders. But every time you get stressed out, your body reacts by tensing up, and it pinches that nerve even more. And so we've got more damage being done. We've got more pain. And so, there might be a physical cause that's sort of starting things out, but it's being exacerbated by mental health issues. Or mental health issues we know can also cause physical problems. And so I think it goes both ways. And I think teaching patients, you're right, to advocate for themselves as mental health providers, also recognizing that at times there are physical, things that we need to consider. That's what I love about our program, is that it combines those things together. Right. It looks at the physical and the mental health side of things. So we really get that holistic approach, which I think more and more people are realizing is the key.
And a lot of times, the patients themselves may say, well, I don't have anything going on in my life that is stressing me, and I don't feel sad. But just because they may not be experiencing those parts of the depression or anxiety does not mean that it's not manifesting in those other ways. And it could be that it's something that what we call stuffed for so long, because it may have been something that happened as a child and they've just repressed that memory so long. But now, as they've gotten older and time has gone on, that stuff's starting to bubble up in the system. And the only way it's coming out is maybe in this horrible migraine headache that they're getting every single night when they're trying to go to sleep.
And we've seen that with the pandemic too. A lot of people's vices, a lot of the, people who keep themselves busy so that they don't feel all of those uncomfortable emotions, and it allows them to kind of avoid and distract from that stuff. During the pandemic, those things were kind of not an option anymore. And so we're seeing problems sleeping. We're seeing, why can't I shut my mind off? Why is all this stuff from my past coming up right now? And that's why, is because, it's like holding a ball under the water. Pretty soon you exhaust yourself, and it's going to come up and pop up and hit you in the face, and you kind of are forced to deal with it. Also, we know that when we stuff those emotions, when we avoid and don't process through that stuff, it does tend to attack the quote-unquote weak links in our bodies. And so if we have a high risk for high blood pressure, if we are at high risk for heart disease or diabetes, it's kind of like when you have a kink in a hose and you build up that pressure, it's gonna pop wherever that weak area of the hose is. And the same happens in our body. It's those emotions that's energy. That energy has to go somewhere. And so it manifests and kind of pops out in the areas where we're at risk. And so, just looking at the whole picture, I think, is really the key.
So if I'm starting to notice changes of behavior in a loved one, what are those things that would be red flags? What are those things that I should be aware of and say, this needs some further attention or evaluation or merits some discussion?
I think a lot of the things that Karmen kind of detailed as far as those physical changes that are happening, but primarily it's, recognizing when there's been a change in something. And so, whether it's in yourself or it's in a loved one, are you suddenly not able to sleep at night? Is the quality of your sleep going down? Are you more irritable? Are you not coping as well? Are you more emotional? Are more and more people, for some reason, asking if you're okay, So maybe you're not recognizing it, but the people around you are recognizing it. Listen to your body, listen and respond. Emotions exist as forms of communication, and they communicate a lot. And so when you're, feeling lonely, what is loneliness communicating to you? It's telling you need to connect with people. It's telling you that you need to, find a sense of belonging. And looking at, when you feel a sense of emptiness, are you taking time to kind of live to your values? If family is something you value, have you been spending enough time with family? If leisure is something you value, are you taking time to go for walks? Are you looking at your whole health? And so just paying attention to, when you don't feel right, when something feels off, whether it's mood or physical, listen to it, listen to your body, and you can kind of look at options from that point. When it comes to family members, I think, or loved ones, we say that fine is the 4-letter F word in therapy. And when anybody says, I'm fine, or, oh, I'm okay, or I'm doing all right, following that up with, but how are you really doing? Because we tell ourselves a lot that people don't want to hear our burdens, and we don't want to be a burden to other people. But, it's important to ask those questions. Don't be afraid to have the conversation about mental health. If there is any time in this world where we all understand stress and we all understand what it's like to have those burdens, now is the time. We're coming out of an international pandemic. There is not anything about the last 2 years that hasn't been somewhat stressful on some people, from whether it's, politics to the school systems kind of, being sort of shut down and trying and all of that, navigating as a parent, worrying about whether your kids are going to get sick or you're going to get sick, or, just the dialogue and all of the things that have been going on. It's normal to be stressed out by that stuff. And it's normal when you don't have the tools to cope with it, to need some extra support. I always say, we fault ourselves for not having the right tools. The coping skills we have, they work until they don't. And we need to recognize when they don't work anymore. And it's not because we're weak. It's not because there's something wrong with us. It's because life has thrown us, a curveball that we just haven't been accustomed to dealing with. And so sometimes it's self-help material. I mean, it's a huge profitable business out there, and so you don't have to spend money to get self-help. There's a lot of resources out there, but start with just looking at your whole health. Start with looking at what you value. Are you spending enough time doing the things that you value, doing pleasurable activities, taking care of yourself? And if you start investing in that and you still don't feel better, maybe it's time to go and talk to your doctor. Or maybe it's time to, if it's a situational stressor, reach out to your employer. Do you have, an employee assistance program where they can kind of, in a short term, link you with a provider that can help you just process through this one event in your life? Talk to your friends. I can guarantee you, we all know somebody that struggled with mental health, if it's not ourselves. And once that dialogue gets opened up, I think people are surprised by how many people can relate to that. And as a provider, I'm always shocked just with how much stuff we carry. We carry a lot of stuff around with us. And if we shared that load a little bit, I think, and we're more comfortable talking about it, I think we would all be able to cope better, with the stressors that come our way.
Well, and I know also that a lot of times people are afraid to approach it.
Right.
They really are. And because, one, it scares them. Mm-hmm. Mental health is not anything that anyone really wants to deal with or has had to deal with in the past. And especially with the pandemic and how much it has made us so vulnerable mm-hmm. to our emotions and having to sit with ourselves for, 2 years. It can be very difficult, but sometimes the only thing that you need to do is just say, hey, do you need to talk?
Right.
Or I'm here to listen to you. And then don't say anything. Just let them know that you're there mm-hmm. and that you support them and that you love them and you want to care for them and help them in any way possible. But you don't have to say anything. No. Because they don't want to hear anything.
Yeah, you don't have to have solutions.
No, not at all.
No, you just have to listen.
And I think being able to normalize it and say, I'm stressed out. Are you? And opening up that dialogue in that way, I think is important. But yeah, and also, especially in our smaller towns, but with our older populations, we didn't grow up talking about feelings, and so it's not just that it makes us uncomfortable, but we don't understand it. A lot of times, I'm always shocked when I start meeting with someone and or even in a group, and it's like people don't know how to name their feelings. People don't know what they're feeling. They don't know how to describe it. They don't know how to explain it. Our natural tendency is to avoid the things that we don't understand. And And when we come from a generation of, tough it out, get back on that horse, pull yourself up by the bootstraps and move on with it, it gets to be really difficult and a huge barrier to admit that this is something that I can't do that with, and I need more help. But it always starts with just a conversation.
Can you talk about why rural areas have some greater challenges?
Well, I know, like, in the rural areas, of course, we don't have the resources available to us like you would, like, in the city. But the one thing we have to keep in mind, too, is that there is a lack of providers in this field in behavioral health and mental health. And
that's nationwide.
Oh, yes, absolutely. There is a lack of practitioners. Like 75% of all U.S. counties have mental health shortage. And at least 50% or more have actually no professionals in the behavioral health system at all. So the lack of just getting any kind of help is out there, and it's very prevalent.
And I think in Iowa, close to 36% of Iowa's population is considered rural, and 86 of our 99 counties are in healthcare provider shortage areas for mental health specifically. And I think, when it comes to one, you have that stigma like we talked about. So not only are there not providers, but the likelihood, people don't want their vehicle seen outside of, a mental health provider's office. And, that is a barrier that we have to break, but it is a real barrier that exists in our smaller communities. One upside of the pandemic, I will say, has been the use of telehealth services. Research is showing that telehealth services are just as effective at treating anxiety and depression as face-to-face encounters. I think it's a preference, that you have to kind of work through and you have to get used to. But one thing the pandemic did was open up access to real quality providers from the comforts of your home. And so, if I can't find someone, or if I'm not comfortable coming to see somebody at my, local provider shop, I can reach out to my insurance company and I can ask if there's a provider, somewhere else in Iowa that meets these needs that I have. And within, hours, I could be connected with that provider. And so it really did help, I think, open up the doors for access. Now, some of those doors will, as the pandemic winds down and the emergency orders and things kind of come to a close, some of those doors will start to tighten up a bit. But definitely from an industry-wide standpoint, we're going to continue to see telehealth be a major factor in getting people the care that they need. Definitely for the rural areas especially.
I'd like to specifically talk about suicide.
When we talk about rural areas, one, it does have to do with the lack of provider access. But we also know that rural areas tend to be farming communities. And farmers are in the population of greatest risk for suicidality. We know that, when it comes to mental health issues, that these mental health issues are often factors in suicide. And for farmers, we think about the economy, we think about the stress that especially family farmers have put on themselves, but also feel from their community, and we see the suicide rate among farmers kind of waxing and waning with the economy. And so when, the farming economy is bad, there's a lot of pressure on farmers, when we have a couple years in a row where the weather doesn't cooperate or where, crops are taken out, a lot of pressure on farmers. And so farmers also tend to be a population where, again, that pride prevents them from seeking out. They are the provider, they are the breadwinner, and they oftentimes feel like they have to be kind of that strong, and unfortunately, it's not true, but unfortunately mental health is looked at as a weakness sometimes. And so, they struggle alone. and the suicide rate among farmers is actually incredibly underreported for those statistics because, again, there's a shame that goes along with that.
You were saying as far as they struggle alone, I have done a little bit of research on it myself, and there's a really fantastic video out there of a farmer who explains exactly what a farmer goes through. And he talks about how, they work all these long hours and they're inside of a box all day long in their tractors, and they have nothing to do but sit in their own thoughts. And like you said, with the economy and how much their crop yields and things, they have to think about, am I going to be able to survive this year? Am I going to be able to afford the seed for next year? If I, all these things that they sit alone with all day long. Yep. And it's expected. I mean, you got to expect that these poor men and women that are out there farming every single day to help provide food for our countries, they're doing it all by themselves, and it's a struggle emotionally.
And it's all they know. And so, when they're looking at losing the family farm, they don't see options beyond that, because this is what they've known from the time they were children. This is what their legacy. They look at this as their legacy, and there's a huge emotional toll that goes along with that pressure to carry that burden. And many times they do, as Karmen said, they carry it alone. They don't want to pass that burden along to their family. And so, in many situations, farmers that do end up taking their own lives, their spouses oftentimes didn't even know that there was an issue. They didn't know that they were struggling. Maybe they saw some signs, but again, it was kind of pushed to the side. And so just recognizing, I think it goes back to the risks, recognizing in times of drought, ask your spouse, ask your neighbor, ask your friend how they're doing with, when that crops have been, when the yield's been low for several years in a row, you can assume they're struggling. When the economy takes a dip, you can assume that our farmers are struggling. So ask how they're doing. As physicians, use that as an open door to kind of have that conversation. But beyond farmers too, I think, elderly populations, we are in the age now where, our baby boomers are having to take care of their parents, and we've got a huge shift in retirees that are kind of coming into play here. And we know that, older men have one of the highest suicide rates of any age group. And just statistically, men aged 85 years or older have a suicide rate of 45 per 100,000, and that's compared to an overall rate of 11 per 100,000 for all other ages. So that's a huge, huge jump. Again, it's just recognizing where those risk populations are and being mindful of that and asking those questions and opening up that dialogue so that we, can let these people know that they don't have to suffer alone. Suicide doesn't just happen because a thought pops into your head one day. And I think there's also this misbelief that if we talk about suicide, it's going to plant the idea in someone's head. I assure you, if they're going to commit suicide, that idea is there. Having a conversation about it does not plant an idea in someone's head. It prevents the action from happening. So I think having those conversations and understanding the statistics is important.
What are some of the key takeaways that we could share with this community to help people improve their mental health and to advocate for themselves, advocate for others, and be a part of the dialogue? What would those things be that you'd want to share with the community?
Basically is to not be afraid to talk about it, not to be afraid to ask those tough questions. And as far as yourself, make sure that you're asking the questions for yourself as well and not be afraid to know it, because you're not alone. We all have struggles and we all have things that we could use a little help and support for. And, we just got to remember that, just because I'm walking down this pathway doesn't mean that there isn't a whole lot of other people that haven't walked the same pathway as I did.
And I think just understanding that, you don't have to feel that way. You don't have to go through life. A lot of times people say, well, I've just always been an anxious person. Well, no, you weren't born that way. That's a learned behavior. And so we can unlearn that. If it doesn't matter, I think if you're, 15 or 50 or 95 years old, to have that burden off of your shoulders and to be able to live feeling at peace and content, that's possible. And, it might just take a little effort, and it might take reaching out and finding the right source of support, but it is certainly possible. And I also feel like, in general, this is a community thing. This is, we are not going to address this issue alone. And, when we see a parent with a kiddo that's struggling, instead of judging and being like, "Ooh, I'm glad my kid isn't like that," stop and ask, do they need help? There's when we see people struggling, instead of passing judgment or instead of just ignoring it because it's uncomfortable, have that conversation, talk and see what you can do to kind of help. Also, volunteerism. Research shows that if you can volunteer more than 100, which is about 2 hours a week, and volunteering could be anything from helping your neighbor out to formal volunteering, your life expectancy goes up.
Really?
It does.
Oh my gosh!
An act of kindness.
Okay, I love that.
An act of kindness will boost your mood faster than anything else. Practicing gratitude. But also health factors. People who volunteer more are healthier physically than people who don't, in addition to the benefits to your mental health. So I think, looking at ways in which we can gain a sense of connectedness and belonging in our community also helps to break down those barriers, because then we're getting to know people, and we're noticing when things are off. From a geriatric standpoint, in our seniors, there's a lot of barriers to getting treatment. And one of those barriers is that, again, people feel like these things they're experiencing are normal. They feel like, well, I'm getting older, I have these health problems. It's normal to be depressed.
It's normal to
and it's not.
Be angry.
And so don't brush those things under the rug. Recognize that, loss of autonomy is probably the thing we hear most often when it comes to, I can't do the things that I used to be able to do. And that is depressing, or that can be depressing for some people. The loss of driving privileges, the any loss of freedom, or, in general, when you're older, your friends are passing away, your family is passing away, and that brings on a lot of reflection and a lot of opportunity to have a dialogue with somebody about their mental health. And so use that opportunity to get your seniors the help that they need, so that they can live a good quality of life in general. So I think just overall, it's being mindful. Employers, same thing. Employers can do way more to impact the mental health community. So recognizing that, from job performance to turnover rates to people calling in sick, all those things are affected by mental health of your employees. So become a mental health aware provider, become a mental health aware organization, become a mental health aware community. And I think it'll go a long way to kind of beat down some of that stigma and help us all.
Thank you so much for coming on to the podcast.
Yep.
Absolutely.
Thanks.
All right, thanks, Kels.
Thanks.